Good morning, everyone. My name is Nyimas Anabella, and I would like to present you my conference entitled A Study of Factor Influencing Purchase Intention of Diabetic Patients Towards Herbal Medicine Amongst Diabetic Patients. Okay. So the background of this research is to find the right marketing strategy and market penetrations for my virus company, Dinara, that I would explain in the later slide. So did you know that Indonesia is actually the fourth most populated country in the world and was also the most citizen with diabetic patients in the whole world? It was proven that 6.2% of our total population were actually diabetic. But of course, these diabetic patients try to prevent their complications by self-manage or self-prevent according to consensus on control and prevention diabetic patient in Indonesia. Healthy behavior that represents self-management in diabetic, including following a healthy diet, increasing physical activity, using diabetic drugs regularly, monitoring blood sugar level, and performing regular healthcare. But of course, we cannot separate Indonesia and our cultural heritage. Indonesia is well known for our thickness in cultural, including herbs and medicine. Herbal remedies are becoming increasingly popular with public eye as they are perceived as being beneficial and free of side effects. In addition to that, customers in general are attracted to quality and benefits of the product. They consider the characteristics of before making the purchase intention. So this brings me to the problem statements, focusing on my company called Dinara as a beverage brand that is newly established, that is still ensuring market validations and lack of information in medical or even market research in the same topic. So we aim to increase sales number through this research with marketing strategy. And here are my research questions, objective and scope and limitations. So the research question is that what are the factors influencing diabetic patient purchase intention of herbal medicines? And what are the factors influencing herbal treatment affecting diabetic patient in choosing the treatment? And what marketing strategy are suitable for increasing diabetic patient purchase intentions with objective on providing answer and recommendations of research questions. So we have scope and limitation with diabetic patients who live in Indonesia, with target responding ranging from age 20 to 60 years old, who are actually diabetic, and this research will also be conducted in qualitative and quantitative using online questionnaire. So here are the company description that I mentioned about. It's called Dinara. So Dinara is a herbal drink company that produce herbal drink company that actually focusing on diabetic sectors with ingredients are black tea, sapanwood, clove, ginger, lemongrass, and cocoa beans, which are all ingredient proven to be effective in measuring glucose level and in controlling diabetic disease. With my literature review, so we know that diabetes is a disease that occurs in blood sugars when blood sugar is too high that hinder body function. Even so, according to World Health Organizations, 80% of population have to use alternative medicines to control or even cure their disease. This actually proves their motivations toward health service and urgency to get better. And that is why a researcher wants to study a factor influencing purchase intention in diabetic patients. So here are the literature review used in this research. And these are conceptual framework based on the previous studies, which are quality of product to purchase intentions, source of information to purchase intentions, knowledge or experience to purchase intention, and price to purchase intentions. And this research will also be conducted using mixed method approach, the collection of analysis of qualitative data in in-depth interview and quantitative data in online questionnaires. So here are the research methodology. So first, we have problem identifications and literature review. And after that, we will be conducting in-depth interview, which the result of this in-depth interview will be used in developing questionnaires. And after that, the researcher will do data collections, data analysis, and conclusion and recommendations. And also in this methodology, researcher will be using judgmental samplings in-depth interview and quantitative, which means that researcher will specify target elements that are tailored to the objective of researcher problem. And here are the data analysis using the transcript and coding for in-depth analysis, and reliability, validity, classical assumptions, and multiple linear regression tests in quantitative research. So, which bring us to the chapter 5 of data analysis and discussion. So, researcher had interviewed 6 narassumbers, and the result of those interviews is that there are 4 additional variables which are halal, packaging, need, and access to products that actually resulted in the interview that actually corresponding to the factor influencing purchase intentions by the customers. And thus, there are 4 additional variables in conceptual framework to halal to purchase intentions, packaging to purchase intentions, need to purchase intention, and access to product to purchase intention. And we've dived into the data analysis. So at first, there are 241 respondents, but because of the filtering process that researchers want to have data analysis in people who actually diabetic and ranging from 20 to 60 years old, the final respondent is 219. And then after that, we conduct quantitative analysis, first validity, reliability, and classical assumption test, which all proven to be all valid and all reliable, and all data are normal, are free from multicollinearity, all data has no heterodexity, and there are linear relationship between the all variable of dependent and independent. And here are the multiple linear regression analysis. As we can see, price and packaging were rejected, which means that quality of product, source of information, experience or knowledge, halal, need and access to product has proven to have a significant positive relationship towards purchase intentions, while price and packaging has no significant positive relationship toward purchase intentions based on multiple linear regression. And then we dive into conclusions with the first question is that what are the factors influencing diabetic patients in choosing their herbal medicines based on in-depth interview and quantitative analysis? The answer is quality of product, source of information, knowledge or experience, halal, need and access to product. And then the question number 2 about how are the factors influencing herbal treatment affecting diabetic patients choosing their treatments. So it turns out that customers like to be in position or to be prepared by storing medicines so that they can be prepared before actually experiencing diabetic symptoms, and that they like to have a medicine that can be found anywhere and anytime. And respondents that think that they want a medicine that have the maximum effects with minimum side effects. And respondents will believe more in reliable sources, for example, from doctors, people who had the same disease with them, and respondents will trust their experience more in context of medicine. And then the last question is that what marketing strategy are suitable for increasing diabetic patients' purchase intentions? So we have advertising, good review, and impression from customer can enable purchase intention to occur to promote the quality of medicines. And investing in marketing or brand ambassador from doctor will gain more credibility. And herbal medicines needs to be available in store that are easy to access and place to easy to see location that can gain customer attention. And here are the recommendations for my company. So the result of the analysis is that conducting more research and development to test ingredients and product quality will actually trigger more purchase intentions and gain brand awareness through community advertisement on online marketing to try and spread brand awareness while distributing product prototypes to gain review from diabetic community. Respondents will likely to trust more information if they got it from promotion and advertisements. And Dinara should make medicine with long expiration date as based on the response analysis. Customers like to be prepared before experiencing symptoms from diabetic with stocking medicines. And lastly, Dinara should be available in online buying or even offline store to be available anytime and everywhere. So those are my presentations. Thank you.